National Ebola Containment Strategy, Preparedness, Surveillance, and the challenge of cross-border transmission is our topic tonight on the front bench. Thank you so much for being part of the show. Those who are watching live on YouTube, also on our X handle, not forgetting that we are also coming to you live on our different radio stations. The program is live, so you don't have a chance to miss. Use that WhatsApp number 0709-602592 to be part of the show, but also the hashtag UBC Frontbench. Honorable Minister of Health Designate, right? Dr. Chris, thank you so much for being part of the show. I last hosted you last Monday, but I remember you were still our Minister for ICT, but right now you are hopefully entering a new office. I do understand you were vetted today. Congratulations in advance. How is the situation like? Ugandans are worried. What is the current status right now?
So thank you very much. Like you have said, I am Minister in Transition, moving from Ministry of ICT and National Guidance and now to Ministry of Health. The list of ministers came out. Today I was vetted by the Appointments Committee of Parliament, and I think I answered all the questions. So
okay.
I want to believe that there should be no reason for the committee to give me a few marks. And then the committee will make a report to the appointing authority once the committee has completed the exercise. And then the president, who is the appointing authority, will share you a day for swearing in. And once we are sworn in, then I will have completed the transition, and then I will go and the outgoing minister will hand over to me, and then we start work. But work can't delay. I have come here to discuss issues of Ebola, even when I have not yet crossed to the ministry of
Fule.
Yeah, Fule, yes, but I'm on the way. Now, like we've been updating the public, we have an outbreak of Ebola. And the Ebola is not new to Uganda, because many Ugandans out there, you recall that we had an outbreak in 2000, which was made in northern Uganda, the one which took Dr. Okwia, a prominent doctor there who was managing cases in Lacho Hospital. And since then, we have had up to 8 cycles, 8 outbreaks. And now this recent outbreak that rose from a case, a Congolese who came from DRC, came to Uganda, fell sick, was sick, hospitalized, he died. Then later on it was confirmed that he had Ebola, and since then many more cases have been confirmed, and Dr. Laro will be speaking to the details with regard to where we are today in terms of how many cases, contacts, and what is happening. So this Ebola has come from DRC, and that has implications, especially for communities that live along with the border between Uganda and the DRC, ranging from West Nile down to Chigezi, because our borders are porous, but also there are lots of movements between DRC and Uganda in both directions, a lot of trade. Personally, I come from Kanungu, which is a border district. Kanungu district borders DRC, and there are lots of movements. Even there are Ugandans who have gardens across in Congo and vice versa. These boundaries, these borders are just artificial. At times they are just drawn on a piece of paper, but on the ground they are not visible there, and that presents a challenge as we manage this outbreak. So we would want to appeal to the public, first of all, to appreciate that there is this outbreak, and Ebola is a dangerous disease because it's highly fatal, but also to say that we know how you can catch it from another person And the mainstay of managing this kind of outbreak is for us to observe the SOPs, the public health measures which Ministry of Health and health workers have been announcing. Because the main route of transmission is if one is infected with the Ebola virus and has shown signs and symptoms, if I am in contact with the body fluids or body organs of somebody who is infected, then there is that risk of the virus crossing over from the infected person to another person. So the main way of how we can successfully fight this virus is to avoid body-body contact. That's why the Ministry of Health has been advising that we minimize or eliminate mass or functions which bring people together, especially in those border districts. But also we all be cautious and observe personal hygiene, issues like hand washing, issues like using a sanitizer, avoiding shaking hands, and all those actions which may make you get into contact with another person where there is a risk of transmission. So it will require a concerted effort by all of us if we are successfully fight this Ebola. Do not leave it to health workers. Yes, health workers have their part. Even as leaders at our level, we have our part, like coming here to explain to the public. But even you, whether you are a health worker or not, an individual, you have a responsibility, you have a part to play. Otherwise, the health workers will not be in your home or when you are traveling in a bus, wherever you are. You should observe the standard operating procedures and the measures which have been announced, how we can minimize the risk. So if all of us play our part, observe these basic measures, avoid contact, and be able to report maybe suspicious cases. Like now, the ministry and the government have announced that we have crossed the border between the DRC and Uganda, except in some few exceptional circumstances, like those transporting cargo and merchandise, those transporting food, maybe the humanitarian crisis workers. So those few isolated cases. If your reason of crossing to Congo and vice versa is not very urgent, wait until when we have successfully fought this outbreak, then you will resume your travel. Yes, police or security or leaders may not be seeing you crossing, but don't cross at night through a panya thinking you have defeated the system. You are actually just endangering yourself and exposing yourself to that kind of risk. So my appeal is to all of us to observe these measures and do whatever is in with our means to support the healthcare system, to support leaders at various levels, so that together we can be able to defeat this outbreak. And the government of Uganda is working closely with the neighboring countries, especially DRC, where the epicenter is, where the challenge of this Ebola outbreak is much more bigger than it is in Uganda, because it will require efforts of countries working together in order for us to stamp out this outbreak in our region.
Honorable, before I bring in Professor to give us some statistics, from where you sit, would you talk about the transition from Ministry of ICT to the Ministry of Health? You do have your own contacts from your position where you sit. You did talk about closing the border. What is the fate of Ugandans? You talk about those who have maybe farms, they be crossing to go to their gardens. Do you think there would be a plan to help them survive in the given period of time, like it was the case it was in COVID-19?
Yes, basically the crossing of the border is with respect to reducing or eliminating the risk of transmission, basically. Now, during the time of COVID, I remember I went to Kanungu and found the RDC had arrested many women with their babies, and that's what is the issue. Or we had given a directive as a government to stop movement out of the country. But these are people who live on the border with the DRC, Kanungu, and they have gardens across, so the women were just crossing to just pick their maize, to pick the beans in their garden. I think the leaders there should assess the situation, because there are situations where you see somebody is just going 100 meters into the garden and come back. That's not the intention of the closure. Such a person, I think, can be allowed depending on the circumstances. But the closure, we mean people who are traveling to Goma, to Kasenya Cross, to go and do business and mix with the people. I mean the people we are looking at. But even those cases of women and individuals going to the gardens, if it is not something that is an emergency and very crucial, we advise that they should maybe stay home and avoid crossing until when, because they may cross, go to their gardens and meet the Congolese also who are there and they get exposed. So I think everybody should take personal responsibility to see that you. That's why when I entered in, I didn't shake your hands.
Yeah, true.
And yet I had the urge to greet you, but we advise people, because I'm not sure whether you are not a carrier
about my movements,
a contact or carrying a virus. So let's take responsibility, all of us, wherever we are, and that's how we can manage to disrupt the transmission cycle of this dangerous disease of Ebola.
Okay, thank you. Professor, what is the current situation when it comes to the statistics? Ugandans want to know. The international media is equally producing a number of things, releasing a lot of information. Right now, Ugandans want to understand how many cases do we have we registered, the number of deaths, and what is the process like to ensure that those that have the virus right now can easily be contained.
Okay, thank you, and I want also to thank the Honorable Minister and again congratulate him. The last time I appeared here with the Permanent Secretary, that time we had 2 cases, and that time we did speak of about imported what? Cases. But now, as of today, we have 11 cases, and now 4 of them are imported, and 7 of them are local, what we call local cases, or those who got on contact or got transmission or infected from the cases which they attended. 5 of them are health workers, but I must hasten to mention that also as of this morning, so far 4 of them already discharged the case 002. 3 additional ones of them have already tested negative, so they are due for what? For discharge. And even the others who are in our isolation are doing very well, and that's the reason why we are saying that if we are able to get patients early, then their chances of what? Of survival are much better. So out of those 11 cases, definitely we have listed over 634 contacts. But what I must mention again, that good thing that today we discharged 22 contacts who had finished 21 days. The way I would count 21 days, we count from the day when you got in contact. So it's not that they have finished 21 days in quarantine, but we count from the day when they got exposure, and so 22 have been discharged. And we expect that if all things remain constant, we expect that by Friday we would have discharged 125. So this is a number which we think that is moving down. All our what we consider as high risks contacts have been placed under quarantine. So all these other cases are developed. We are picking them from those who are already in quarantine. And the good thing with this is that it minimizes community transmission, because in a case we pick out from the community, it comes with the transmission chains, with some of them you will need to have to understand. So most of this we are picking from cases who are in quarantine. So majority of them, and also by the time we discharge from quarantine, you are tested. So we are very certain, and I want that the community not bring any stigma to the people who are being discharged, that they are coming back from the treatment unit, they have what? They have Ebola. No, they should be, we test, we make it, undertake a test, and so that by the time they come out, we are certain that they have no Ebola which they can be able to transmit to the community.
Prof, we have a lot of fake news circulating. How basic can Ugandans get clear information? I did talk about the international media releasing a lot of information, and you know how fast information spreads around the world, but also to the people. So we have fake news. I did talk about some rumors that I had. There is a Health Center 3 that was closed in Chisenyi. How true is that?
As I did mention when I came in here, that rumors or fake news spread faster than even the virus. And I must say that we've been constantly updating the country, and we want that people only get information from certified areas as the Ministry of Health or the media center. Those are the only ones which can be able to communicate, or the Permanent Secretary or myself. And even if there's anybody who wants to access information, I must say that Uganda is one of the most transparent countries. But also this is as part of our alignment to the international health regulations. So we really would want people to desist. We have, apart from you that you have heard that a facility has been closed, others actually were calling me that there's going to be a lockdown. We don't have any intention of what?
Locking down.
So we have only highlighted the border has crossed, and the purpose why we crossed it is to minimize cross-border transmission and the risk it comes with. So we'd want the communities around there to act as our surveillance officers. If there's anybody who crosses, they should be able to raise this information so that we can be able to test. So fake news definitely causes a lot of harm and a lot of anxiety, and we really would want to emphasize that let people just wait. As a ministry, we will be able to update them. This morning we met with the international community.
Okay.
We gave them the assurance. They asked the question which they asked, we provided them. I also want to just reassure the global world that all our contacts will provide them on a no-fly list. So we provided a list to the Ministry of International Affairs, so they cannot fly out of this country. All the previous outbreak which the minister has mentioned, we have not exported Ebola outside this country, and we really would want that we manage it within this country.
About preparedness, Prof, last time you did talk about a few steps that you have taken so far. How more have you geared up to ensure that it doesn't spread wider besides the lockdown that we have on the border of DRC and Uganda, but now to these other areas that are hotspots?
So we've mapped, or we have done what we call risk assessment, and we've put over about 31 districts which we consider high risk districts, and then the others are categorized as high risk, and the rest of the country is characterized as moderate. There's no part of this country which will be characterized as low risk. All of them are moderate one, because it's just a matter of one day and we'll do one. So we have positioned our laboratory to minimize the turnaround time. We have a lab in Arua which is able to test. We have a lab in Buera Hospital which is also able to test, and we still have capacity of 4 additional mobile labs which we can be able to deploy depending on if we are able to pick up which are the additional epicenters where we need to deploy. So the capacity there. In terms of emergency medical teams, we also have people who are already trained. So like the ones who are working in the isolation unit, for the sake of their mental health, we change every month. You cannot work beyond 30 days. We change the what? We change the teams.
All right, Honorable.
Yes.
Professor has clearly stated about the labs. We do have mobile ones, 31 districts that have been mapped. Yeah, he has talked about the health workers that have been trained, but now the response capacity. Do you think we can easily contain this virus from within, so that we remove away that worry that Ugandans have as far as this virus is concerned?
Yes, first of all, I want to thank the Ministry of Health, because Ministry has been in charge in terms of giving information, but also putting in place systems to contain this outbreak. And before I answer that question, let me comment on the issue of information and news and the misinformation. The Ministry of Health remains the source of information. Even when I've been communicating as Minister for Information, I liaise with the Ministry of Health to get the statistics, the data, what is current, so that we have harmonized the information that doesn't confuse the public, both local and international. But also one concern which has been raised is that at the international level, when they report, they put us together with the DRC, and then an impression is created as if the situation obtaining in Uganda is the same like what obtains in the DRC. And yet, yes, Ebola is here, the risk is there, but I think here the cases are fewer. We are isolating the contacts. We have a functioning healthcare system, and the international community should not be scared, especially travelers who intended to come to Uganda. I have been assuring the international community that even when, yes, there are cases of Ebola, but it's still safe to travel to Uganda and transact business, do the tourism. You follow the measures which are in place, and still you remain safe. So we wouldn't want to scare the international community. Now, yes, first of all, like I have said, we have had a number of outbreaks in the past. While that, of course, is bad, but the positive part of it that it gives us experience, it gives us lessons, and over time, capacity has been built for our health workers and the healthcare system. So an outbreak of Ebola is not very strange, because we have handled similar outbreaks in the past, and that's why we're able to establish laboratories, empower and build the capacity of health workers, disseminate messages across, and put in place all these public health measures. And we are very hopeful that we should be able to contain this outbreak. And because of that rapid response, that's why probably I have not seen the situation become explosive, because the index case, the first case that the Congolese entered Uganda, I think on the 10th May and died on the 14th, and the confirmation of Ebola was made on the 15th. Now today is 1st June. Probably if we had not mounted this response, we would be having many more cases than the 11 that the Director General has reported. So yes, of course, Ebola is a dangerous disease, as we all know it, but there should be no panic in the public. What we require everybody to do, like we have said, is to, first of all, you Ugandans out there, listen to the messages which are being aired on radios, on television, and the other media platforms, to know the do's and the don'ts. The do's and the don'ts. When you are gathered in small functions or any gathering, ensure that there are these SOPs, hygiene and sanitation measures should be in place, like hand washing, using a sanitizer, and so forth. And the health workers, for them, they know what to do. They have protective gear, even when they are handling suspicious the risk of transmission. So the public should not, yes, we should be worried that Ebola is not a simple disease, but there should be no panic. Like the DG has said, we are not going to announce a lockdown and put disruptive measures per se, but it will take the responsibility of all of us. All of us should take responsibility. For the major challenge that we face as we manage this outbreak is that we have a worse situation across in the Congo, in the DRC. And Eastern DRC has its own dynamics, with the many communities facing humanitarian crisis. You know, Eastern Congo has very many marauding rebel groups that disrupt citizens there. Like there is a part of Congo, like that one opposite Kisoro, managed by M23, the one in the administration. You know, there are these mining activities where people come and put makeshift structures and have concentrated settlements and so forth. So the dynamics there are a little bit different from our side. The systems there are probably much more fragile than they are here. And for us to successfully contain this outbreak, we must also keep an eye on what is happening in the Congo, in the DRC. It's like if you are mopping this floor, if it is dirty and you are mopping it, but there is a leakage somewhere up there, it is not enough to just mop the floor. It also becomes important to make sure that that leakage is sealed. That's how you can. So similarly, we are doing whatever it takes to do what is necessary to contain this outbreak here, but also we must keep an eye on what is happening in the DRC. And that's why we are emphasizing, especially to communities that live along the border. There's so many districts that are on the borderline. We appeal to the leaders, both the political, the civic leaders, the traditional leaders, religious leaders, and everybody to really be on the lookout, because Ministry of Health and the government may not be there to man every inch on the border, but people should take responsibility and know that the announcement to cross the border is not intended to harm people or to harm them in terms of business and so forth, because we know places like Kasese, people on this side, they have relatives across, but please, let's stop the movement across the border for now in order to safeguard our lives. And then once this outbreak is contained, then we can resume the movement. So it will require a lot of responsibility on the citizens, especially like we have announced in those districts from Kisoro to Kanungu to Rukunjiri, Kasese, Toroko, Bondibuji, all those districts. Please avoid these massive gatherings where there is a heightened risk. Don't, for instance, say, oh, me, I will do it at night to defeat the system. You are just injuring yourself, putting yourself at risk. So we are going to talk, but also you, the media, you should assist us in disseminating this information.
Rightful information.
So that our people take responsibility in their hands, so that together we can be able to contain this outbreak.
Honorable, allow me go for a short commercial break. Professor, when we do return, you will also clarify on how ready Uganda is to combat simultaneous outbreaks. We shouldn't forget that not only outbreaks, we do have malaria, we might have issues like cholera, but now we also have Ebola, so it is within your mandate to ensure that Ugandans are safe. Allow me go for a break. When we do return, we dive more into the subject matter.
This is the Front Bench.
Every Wednesday, live in our studios in the heart of Kampala.
We have to change the political culture in this country, really. Who has bewitched Ugandans?
I want to assure you, as government, we shall do whatever it takes to ensure that Ugandans are safe.
We have conversations that have analysis, explanation.
This law society, this union of theirs, because they want a job everywhere. They want to be this, they want to be that, they want... No. We know it's a union.
You cannot be making a road, bitumen grade 1, in Congo for 5 billion.
But not every truth is fact, and not every fact is truth.
The argument that the General Court Martial is responsible for peace and stability is without basis, either in law or in fact.
We have been told how Napoleon was a great orator. Now, Napoleon cannot help me get food. They told me combine harvesters in Saskatchewan. I don't know where Saskatchewan is. The geography were taught. Instead of teaching me how to preserve Mabera forest, they're teaching me about Rhineland. This is the problem we got. We cannot run away from it.
Right now, you hear very disgusting stories of members of parliament. Instead of discussing the details of loans, they ask for their cuts.
Every Wednesday, 10 p.m. on your public broadcaster.
All on your public broadcaster, UBC, inspiring Uganda.
My question is, what is the difference between rental tax and income tax? How comes I'm paying both taxes on my own premises? If you want to have a tin, but you are not making any income from your business, you should take on the obligation to continue filing your nil return.
Commissioner General, to invest in taxation. When people understand taxes and they know the importance of taxes and they know the fair assessment of these taxes they're supposed to pay, I think everybody will embrace taxation.
As banning groupage cargo, clearance protects small traders who cannot afford to import full container loads individually and rely on consolidation to remain competitive. Cargo to come in groupage is consolidation, it's legitimate, and we can't ban it. What we have banned, or what we have stopped, is the use of container leaders. Now, Fiona, the good news I have for you is that among the new tax proposals,
now you can get direct answers. Send your tax-related questions via WhatsApp or SMS to 0790-141-887 and the Commissioner General of URA, John Musinguzi, will personally address them. Tune in to UBC News Tonight every Monday and Wednesday for expert insights and clear explanations. Buza Commissioner.
This is the Front Bench.
This is the Front Bench. Thank you so much for keeping it UBC. By the time we went for that break, Honorable Minister was explaining about the capacity, the response capacity, and how ready Uganda is to do whatever it takes to ensure that Ugandans are safe. Professor, about simultaneous outbreaks, Ugandans also, they do demand, actually, they do demand. Yes, we do have Ebola, but we shouldn't forget that we do have other issues to handle, the likes of cholera, the likes of malaria, and also these other diseases. How ready is Uganda to combat such in case need arises?
Okay, thank you once again for that question, but allow me first to say that apart from, in addition to our lab capacity has gone even beyond just testing. So we are able to do even what we call genomic sequencing, and we are able to link. So all our cases, because that's important for the outbreak, if you have cases which you are not able to know their link, then it means you are not in control. So we are able to link that, like we know, like case 002, there were 2 people who acquired infection from case 002. The other cases got infection from case, the probable case, who passed on. So we're able to do that, and that capacity is. We also were able to show that this virus, whereas it's close to Ebola Bundubujo of 207 and 208, is completely also different. So it means that probably is a new zoonotic spill which was from the environment. So starting from COVID, And I'm privileged that during COVID, actually I did chair the continuity of essential services pillar. And that's why we say that normal outbreaks are very disruptive. And sometimes if you don't keep a tab on an eye on other services, more patients actually can die from other causes, can die from malaria, can die from preventable, immunizable diseases, and maternal services. So we have a pillar specifically which is called continuity of essential services, which is there to look at that these services are key. 2 days ago, we were able to speak to the health workers to inform them that they should be able to have a very high level of suspicion. Because they are frontline, they cannot stop offering the services, but while they offer the services, they have to take care and protect themselves. So we did emphasize the aspect of infection prevention and control, and because if you practice infection prevention and control, you are able to protect yourself. And when you protect yourself, then you are able to protect your patients. And when you protect yourself, you also protect your colleagues. And you can be able to protect the community. Because if you look at that, if a health worker got infection and is in a community, first of all, it puts a risk to his what? His family. That's the immediate people who are around. If he takes the public transport, then all the people who are in that get exposed. So that's really why we emphasize that, as the Honorable did mention, that we emphasize on hand washing, sanitizing, because the capsule of the virus gets destroyed by soap, gets destroyed by what? Sanitizer. So when you practice those few and then you put on POPs, put on gloves, if you do that, then you're able to do what? But bottom line, definitely, that while we're emphasizing that is because we want to make that other services should be able to continue. A mother who needs to deliver should be able to deliver.
Yeah.
Anybody needs an operation should be able to operate. So, but at the same time, they should be able to look at what's the travel history of the patient, what is the patient presenting with, because what we have so far seen is that apart from presenting with malaria, it does not mean that a Ebola patient will not have malaria. Actually, sometimes some people have been misled, because when they do a blood slide and say it's positive, then they say it's malaria. But you might have to find that the person also has Ebola. So we need to take that into consideration.
Honorable, are we investing enough in prevention and research?
Well, we are trying our level best, but definitely our level of investment in those areas is not adequate. And later on, as I will be speaking to the media about my new role as Minister of Health, we want to see how we can mobilize additional resources from government and the other partners to focus on prevention and health promotion, as well as research and other areas. Yes, we put in resources, but they are not adequate, I can say, and more work needs to be done. But like he has said, we've built reasonable capacity in terms of laboratory work. Like somebody was sending me a message that I hear you are saying this Ebola is Bundibujo, so they don't know what. These are strains of Ebola virus. The first cases of Ebola occurred, like the statistics have been shown on the screen, in the DRC in 1976 and the Sudan, and therefore we have a strain called Ebola Zaire, Ebola Sudan. Then in 2007, 2008, we had the Ebola outbreak in the Bundibujo and in Torogo areas. And now that strain that was identified then was different from the previously known strains. What makes the differences in strains is the genetic makeup of the virus. So that's why it was named Ebola Bundibujo, because it was the first time the scientists isolated this strain of Ebola. And the current outbreak, the strain resembles Ebola individual, but like Dr. Charles has said, the strain has again more mutations, changes, seems to be a little bit different from that Ebola individual. So as we study it, probably it might become a new strain altogether. So there is some reasonable capacity within the country in terms of laboratory work and scientific work, but definitely we need more resources to invest in research and prevention, but also to manage these outbreaks.
In line with Doctor, sorry, in line with policy direction, do you think we do require some policies to drive the agenda home for the sake of Ugandans?
Yes, we live in a region which is prone to some of these diseases. When you look at this belt of DRC, Uganda, Central Africa, South Sudan, this axis is prone to some of these pandemics, and therefore, yes, we have existing policies, but we need to review them and strengthen them so that we are able to have stronger capacity to be able to withstand and contain some of these epidemics. So yes, we have policies, but we should review them as the situations arise. Like you see now, Ebola, the epicenter being in the DRC. I think like up to 3 provinces are affected: Ituri, North Kivu, South Kivu. But again, they spill over into Uganda. So we need to look at the policy. What kind of measures can we put in place that can be able to minimize this kind of spillovers and so forth? Yes, we need to examine the existing policies and strengthen them so that they help us to manage these kind of diseases.
For communities that resist health interventions, Honorable, how best can you help such people? Government usually comes out with initiatives for the good of the people, but you understand that some Ugandans say, no, some of us, we shall not follow that.
Yes. First of all, we have laws that make it imperative that you should comply with the health regulations and requirements, like immunization and other services. But of course, we're not a government which just wants to force the law in a raw manner. We always want to educate the public, educate the masses, for the people to understand. Because all these measures, they are meant to safeguard our health. Unfortunately, our communities, you still get pockets of communities who resist some of these health measures based on faith and religion or cultures and so forth. So, yes, we legislate against some of these, but most importantly, we need to intensify community education to sensitize the people. At times it is just ignorance that drives these people. They do not know that if you don't get your child immunized, this child will be prone to getting these childhood diseases, and the child will die, definitely. So that's why I was saying we need to invest and put more resources in health education, in preventive health care and health promotion. But of course, where we reach the extreme, we can use the hand of the law to have sanctions of those people who resist. But it's an area which we have interest in, because our duty as Ministry of Health, as health workers, is to protect the lives of everybody. So people out there who you hide under the cover of faith, under the cover of culture, to defy known measures which are meant to keep us alive, you are wrong. And you should review all these. And if there are religions and other practices that actually contradict the messages of government, we can ban them and use the law to have them charged. But first and foremost, we think we should give them the correct information, sensitize them, because some of them are just misled because of ignorance.
All right, Professor, as we wind up, local government, have you empowered the local governments to respond independently before the national support comes in?
We have the National Task Force, which is chaired by the Vice President.
Okay.
But also we have activated the district task forces, which are chaired by the resident district commissioners or the RCCs. So yes, all of them are activated. All the government systems, because it's like a whole of government approach. All of them are activated. So each district is, especially the ones which are in the border areas, have been activated. As you know that there was guidance on closure of the border, but also closure of the weekly markets at the border. But at the same time, definitely he also has a role to oversee that there is standard adherence or compliance to the standard operating procedures in schools, in terms of mass gatherings. So they are activated. Only our observation that others are working very well. So we just only need to follow up with those which are not doing what? Doing very, very well.
Okay, Prof, your last remarks, what Ugandans need to know, what the ministry is working on, before I go to the Honorable Minister to give us his remarks.
Okay, I will start. My biggest call definitely is the health workers, that because of occupation they are vulnerable. Because as I did mention that 5 of the cases are health workers. So we would drill that they exercise vigilance, they practice IP infection prevention, and make it a daily culture of whatever they do, because IPC will save lives, will protect them, also will protect their patients. To the community, we really will call, we need alerts. So wherever, yes, people sometimes call them rumors, but every rumor which is provided to us, we shall investigate. So we really need any alerts from the community. If you see any patient manifesting, if you see any patient who has crossed from across the border, because the challenge, the news which we're getting from across, from the other side, is that many people are being told that there is a drug which cures Ebola in Uganda. So many people are making all efforts to come to Uganda. So we really need that we are able to identify these cases, because as I did mention that any single case starts a new chain of one. But if we remain with the ones which we have currently, then we are able to have this outbreak. I also want to share again the same concern with the Honorable mentioned, that even if we did whatever we did in Uganda, if we don't see that the outbreak in Congo ends, we shall still remain vulnerable, because our borders are porous. So we have had a joint discussion with the government of DRC, and we are going to see that how do we collaborate in terms of information, in terms of the laboratory, and also, but also in terms of additional deployment. When this is concluded, then we should be able to see that we manage most of these cases from the source. Because if we don't do that, then they will come to Uganda.
Thank you so much, Professor. Honorable Minister, your parting shots, not forgetting to mention a few. We have about 5 minutes to get out of here. What Ugandans should expect out of you?
Okay. First, the parting shots on Ebola. Ebola is a dangerous disease, like we have discussed, and the government continues to announce measures. They may sound painful because they disrupt some of the activities that we are doing, but they are in good faith and intended to protect all of us. Like the announcement to call off the Uganda Matters Day celebrations in Namugongo.
Yeah, where this one is
actually this week. It may hurt and pain the faithfuls, but it is for the good of all of us. So we would want Ugandans to understand. The business people across the border whom we are saying, please halt, you are crossing into Congo and vice versa. It may injure your business opportunities, but it is meant to safeguard all of us. So we want Ugandans to understand. We want to appreciate the health workers. We know in a situation like this, they are at a heightened risk, but as a ministry and as a government, we shall ensure that we provide protective gear and give them all the support to be able to safely handle whatever cases may be at their disposal. And we shall continuously come the media to explain if there are any major announcements and measures to make, communicate them to the public. But please, our appeal that they will take the responsibility and active participation of every person if we are going to suppress and contain this outbreak, especially those who live on the border with the DRC. Be vigilant, be the surveillance officers, be the police people, and discourage yourselves from crossing, but also be on the lookout. If somebody has come from Congo, report the authorities so that appropriate measures are taken. Like doctor has said, if all of us remain responsible and vigilant, we can be able to keep the number of the positive cases that were there, be able to contain these and observe these contacts and suppress the transmission and be able to wipe it out as we support our brothers and sisters in the DRC to also have the outbreak down. Please do not behave the way I saw there was a footage that was saturating, I think, the DRC, where somebody had died of Ebola and the health workers were trying to have a safe burial, but the communities just came, fought the health workers off, overcame them, opened the body, they were touching it and so forth, really showing that a lot needs to be done in terms of educating the people on the do's and don'ts. So they were just ignorantly exposing themselves to the danger of contracting the Ebola. So, but Ugandans and the people out there, let us all be cautious and vigilant, and we do what is supposed to be done. Now, in terms of what Ugandans should expect, first of all, I thank the appointing authority, President Yoweri Museveni. I had been in the Ministry of Health earlier on as the Minister of State in 2015-16, and now I am back. But also, the Ministry of Health is my parent ministry, having qualified as a medical doctor. And I know there is a very strong team, technically led by Professor Charles Solaro and many other professionals there. An established system. The role of the minister is to give political supervision to the ministry. Definitely issues of health and health care are very sensitive because health touches every Ugandan, every person, and health deals with life and death, and therefore we take our responsibility as Ministry of Health as extremely very important. We shall focus on preventive health care and health promotion because we are alive to the nature of the disease burden in Uganda, that the preventable illnesses still contribute a lot to the morbidity and mortality burden in Uganda. So we need to invest in that. But also we have to strengthen the other aspects of health care, the curative, rehabilitative and supportive, as well as palliative care, the hospital and the health facility system. We need the infrastructure. The policy of government is to have a health center 3 every sub-county, a health center 4 every county or constituency, a district hospital in every district. We shall mobilize resources from within and without to see that we address those issues of infrastructure, but also, most importantly, the workforce. One challenge that we face today is that when Charles and I qualified as medical doctors, those days the government would post you to a hospital automatically. They post you to Boroto or Arua or Pundibujo or Kambuga, Ukabale. But today, with the decentralization, doctors at the district level are recruited by the District Service Commission. And what happened that there are many medical schools that are training doctors, for instance, and other health workers, pharmacists, clinical officers, nurses, but they are not being absorbed. So we probably have more doctors on the streets and running grocery shops than those who are in the hospitals. So one area we want to look at is how to get sufficient resources to recruit additional health workers, especially doctors. We had discussed in cabinet that we should deploy medical officers down to the level of a health center 3 at the sub-county level. So these are some of the areas we're going to look at and see that Ugandans are served. But also the issue of drugs and other pharmaceutical supplies. There is an outcry out there of drugs being inadequate. At times people say, oh, the health workers steal the drugs. It may not necessarily be the case that they steal them, but maybe we have to look at our population growth and then vis-a-vis the budget that we provide to buy these drugs and so forth and so forth. But we shall definitely fight drug thefts wherever they are, but also address issues of absenteeism, low morale and lethargy among the health workers, so that there is animation and vivacity, energy within the health sector. We would want to raise the standard and the level of health care in this country, so that Ugandans are able to get affordable and efficient and high quality health care. Lastly, when I was in the committee of parliament, I think a concern was raised about affordability of health care in hospitals like Murago, the regional referral hospitals, for specialized services like cancer management, heart institute. They're saying there are no exemption criteria where the poor can get services. So we are going to examine all these and see that we have sufficient provision for those who can pay, but also for the indigent, those who are unable to afford services. We should be able to provide for them, as well as visiting the issue of health insurance. And financing health care. So the work is cut out for us in the ministry, and I joined the ministry with a lot of energy, vibe and stamina to confront and tackle all these issues, so that we can have high quality medical care and services in this country.
Well, thank you so much, Minister for Health Designate, Dr. Honorable Chris Bariomonsi. Thank you so much, Director General, Health Services, Professor Charles Olaro. Ladies and gentlemen, we do expect a lot from the Honorable Minister. He has mentioned quite a number of things. We wait to see how things will really unfold. About Ebola, the ministry, the government is doing whatever it takes to ensure so there is no cause for alarm, no need to worry, as per the assurance we have gotten from the technical personnel. Those who have been listening in online, thank you so much. Those who have sent your messages, thank you so much for being part of the show. I am Jethro Kasaiji. Till next Monday. Good night.
Thank you.
Thank you so much, Honorable Minister. Thank you so much, Prof.
We